please join me in welcoming Professor Toni Ungaretti.
Thank you, Mark. I really appreciate the opportunity to talk with all of you. I hope we make this a dialogue. We're going to talk about learning theories and their practical implications for your teaching. I'm going to share my slides and we can get started. As Mark said, I direct the Master of Education in Health Professions, and I just wanted to share with you that we prepare interprofessional leaders and change agents to transform health professions education globally through teaching, research, and leadership. And I'll share a little bit more of that later. As we talk in this session, what I would like to do is ask you, what do you want to learn in this session? What can we do that you would like us to look at? And I'm going to unshare for a second so you can see that, so we can see you. Is there anything specific you want me to address as I talk about learning theory?
I guess for me personally, I have a feeling that most people don't know what all the learning theories are and don't recognize what they kind of naturally or intuitively apply in their own kind of practice. So I think it would be a really good kind of reflective kind of session for everyone to see, oh, well, I actually, I adopt these particular, constructs and maybe that's a good thing. Maybe that's a bad thing. Maybe I can.
Okay. What I can do is I'll just go through a brief chronology of a couple of them. We'll talk about them. We'll talk about maybe examples from your teaching that you have of them or things we could do with them. So I was going to approach it that way. I just wanted to see if there was something else anybody wanted to look at before we start this. The thing that's important for you to know is I'm not trying to have you become a certain kind of teacher. What I want to do is I want you to maximize you to be the best teacher you can be. That's what's important from my perspective. And so as we're talking, the thing that I really want us to think about is how can you use these theories to help you in your teaching so you can feel better and feel like you're more effective than you've been to this point in your career. We're always learners, we're always growing. And I only get nervous when people tell me that they've arrived as a teacher, because I think we spend our whole careers arriving or trying to arrive to be a teacher. And by the time, if you think you've arrived, then you make me nervous because I've never seen anyone who's arrived. Okay. So this is where we're going to go. Our goal is to maximize you, make you the best teacher you can be. And I want to start by talking about your teaching. And I'll go back to my sharing screen. Your experiences include both informal and formal teaching opportunities. Informally, you had parents, you had counselors, you had coaches, you had relatives, people who would just always be helping you in some way and ways, and they influenced how you teach. And you also had formal ones. It's easier to recognize the formal ones because we're students in school. We go to grade school, we go to college, we go to our professional schools. And this is the roots of who we are. We are rooted in our values, our beliefs, and experiences. And this is the basis of you as teacher. And what we want to do is think about how do we help you use that to the best of your ability.
Sorry, Toni, I don't think you've shared your screen.
Oh, it didn't come over? Oh dear, I'm sorry. So you share as parents, as things like camp counselors, as coaches, you've been all these experiences and that's helped you be a better teacher. You've also had formal education, grade school, college, professional education. So these are ways in which you take your values, your beliefs, and your experiences, and you combine them in terms of watching these people, seeing how they teach, and putting together who are you as teacher.
Sorry,
now, when
Toni,
we talk about teaching,
I'll interrupt again. We're just seeing your desktop at the moment.
Okay,
Yep,
so now we
perfect.
see teacher, camp counselor, coach, school teacher, college professor, professional trainer. This is who we are. This is how we learn. Now I want to talk about teaching. Teaching is dynamic. when you teach, you find yourself at different stages, and these stages change. They're not always the same, and it doesn't matter if you're a new teacher, you've taught a while, or you're very experienced. It's dynamic. When you're in a new teaching situation, you find yourself in survival. I remember when I first started teaching, what I did was, I had 2.5 hours to teach, and I was just praying that what I knew would fill 2.5 hours. I was just, could I survive this? And that's how we feel. We're very focused on selves. When we teach for a long time, we get strategies and techniques and we put them together in bunches. And so we're focused on, did they really enjoy us? We're performers. So we focus on technique, and we think a little bit of ourselves and a little bit of our audience. And at the last level, we lose ourselves totally in the process of teaching. And we think about, are they learning? And so everything we do focuses on impact. And so we're selfless in that. And Fuller talks about these as stages of concern. And once you get to impact, unfortunately, we don't always stay there. If you face a new teaching situation in terms of people or situation or content, you might slide back and have to build yourself again. And expect that as your teacher. And I'm saying this because I want you to be confident in you as teacher, even when you experience this. Now we're going to talk about learning theories. Why do we study these? Well, they provide us with some insight. They serve as tools to help us diagnose our learners. They guide us in selecting strategies and techniques so we can maximize our learners' learning. And they help us predict learning outcomes if we have to measure it. What we're going to look at today are a few classical learning theories and then a few adult learning and development theories. The classical learning theories tended to occur in the early to the mid 20th century. In the later 20th century and the early 21st century, we started to see theories being very specific in terms of how they address learning. So I'm going to just briefly talk about each of these theories. And as I talk about them, I want you to think about experiences that you've had as a teacher or things that you might want to do that would reflect some of these ideas, and be ready to share them. As I share each one, I'll stop and say, do you have an example? Or is there something we can talk about in terms of an issue you may be experiencing? So in classical learning theories, we start with behaviorism. And behaviorism, there's two kinds. There's classical conditioning and operant conditioning. And we're all very familiar with this. If you ever took a Psych 101 course, I'm not teaching you anything new here. But the thing that's interesting about it is classical conditioning is an involuntary response. And so things like being hungry, being fearful, and having them connected to things that shouldn't bring that on are things that you need to think about in a teaching situation. If you have a student who's not performing, are they afraid of something? Is something bothering them that isn't really obvious, but is connected to something in their life? So keep that in mind. In operant conditioning, we're talking about a voluntary behavior. And in operant conditioning, what's really happening is we have our learner making a response to a stimulus. And when that learner responds to that stimulus, we need to reinforce it. Now, there's two different kinds of reinforcement. There's positive, which means anything when added to a situation increases the likelihood of a response. And so if someone gives an answer in something that you ask and you say, great, you're right on target, that's positive reinforcement. Negative reinforcement is often confused with punishment. And I want to separate these for you because negative reinforcement can help learning. Punishment just stops behavior. It doesn't help us learn. So when we talk about negative reinforcement, what we're talking about is in order to avoid something, a person will do something. And so in order to avoid being reprimanded by a superior, the learner will perform a procedure and take records on it and make them available so they're not reprimanded. And so here, to avoid a negative situation, the person acts in a certain way. Punishment is when you just stop the behavior. And it could be some like, okay, you failed, you're done. There's no recourse to failing. That's it. And so if you give a student a second chance to do something and say, in order to avoid failing, do this, that's a negative reinforcement. Okay, and I just want to make that separation because behaviorism is very powerful. It's mechanistic, so we sometimes don't like it, but it works. And much of our learning is behaviorist. Anytime you find yourself in a situation where you get some kind of reward, and the reward has to be a reward that the learner feels, not a reward that the teacher picks, but a reward that the learner feels. then we're operating in behaviorism. And much of your early education is behaviorism, and much of your training where you're doing skills is behaviorism. So think about that. Any examples you want to share?
I've got an example from home with, with
Okay,
my
that's
almost 6.5-year-old. With I suppose it's a negative reinforcement thing when, you know, screen time limitation.
In order to be able to watch this, you must. You got it. That's a great idea. Is it Namali? Is that your first name? Great. I want to talk now a little bit about cognitivism and constructivism. This one seems to be a little bit more palatable to people because we're talking about change in your mind, change in your mental models. And I'm just going to share a cognitivist model from Piaget and a constructivist model from Brunner with you. And Piaget talks about the process of schema, and I'll use a very simple child model to explain the process of adaptation of schemas to you. Basically, you think of young children, they know the idea of a dog, and they see a cow and they say, "Oh, dog," you know, because that's their idea. But when they see, oh, a dog's like this, but this is like this, and it doesn't match, they try to put it in. Well, it has 4 legs, it has fur, so it's a dog, but these things don't match. It's really big, it's got a strange looking head, it's got this funny tail. And so they go into a disequilibrium until they figure out, oh, this is not a dog. There's a dog, but now I have a bigger schema that's animals, and I have dogs and I have cows, so it's bigger. So my mind has grown, my understanding has grown. When you have a student that you're working with, this student has an idea of how to take a medical history, and they take it and they invariably leave something out the first couple of times. And you say, okay, well, this is what you need, what you have, but you have to add this. So as they learn to add it, they deal with what I know doesn't really fit. So I can't assimilate everything I know to this situation. I have to accommodate, I have to change, and I grow and I change. In that process, the learner moves from being like confused or lost, which is disequilibrium, to a state of stability and saying, oh, I get it. And that's when they come together. Constructivism builds on cognitivism in that constructivism is really the application of cognitivism to learning. And in constructivism, what we're talking about is students gather information, and in that they work with it in their mind. They have imagery, memories, existing frameworks, and social context for this information. They make sense out of it, they make it meaning, and it becomes part of them. And that's constructivism. And I think much of what you're doing in medical education is constructivism, because you're giving them lots of opportunities to bring in information, process it in the context that they know, and make sense out of it for themselves. And you test them by watching them in terms of how they act. And something I always used as a process when I go into a situation where I'm observing preceptors working with students is I use the idea of letting the student tell the preceptor how to do a procedure, because then as the student's walking through, the preceptor can unpack that student's thinking and see where they got it right and where they didn't get it right. And the patient is not at risk. Okay, that's the nice thing about it. Then after you do that, then the student can do it and tell the preceptor what they're doing through that process. So it's a process of learning. Something else that's important to constructivism is the concept of scaffolding. You know, the student's level of learning is here and you need them to go to here. If you just jump up there, you often lose them, or it becomes too much change, they can't deal with it. So what you do is you think of ways to scaffold the learning. You make it simpler, you ask questions, you provide information, you provide guidance, and I'm going to show you 2 models of scaffolding. Here's one: determine what they know, set a goal for their learning, plan the supports for that learning, and how can those strategies be broken down. Implement that learning, monitor their progress, assess their work and give them feedback, fade support over time so that they can become independent, and continue monitoring them even when they're working independently. So that takes you through a scaffolding process. Another thing is, this is a list of things to do for scaffolding. modeling, explaining, giving hints, feedback, instructing, questioning. All these things help the student construct the knowledge for themselves and make it their own. When we're teaching in a lecture and we're just telling, we don't know what they know. So we've got to find ways to test what they know, to understand their learning, asking questions, explaining, getting them to explain, getting them to demonstrate. All those help us through this process. Now I want to talk about a third area, and this is humanism. And humanism is very person-centered. And I'm going to talk about two people's work, Maslow's needs hierarchy, which many of you probably know, that it's important to satisfy basic needs like physiological needs and safety needs before you can deal with accomplishing schoolwork or becoming a competent physician or even being recognized as a competent physician. So if you have students in your classrooms who are not doing, who don't seem to be attending, there may be things like, are they tired? Are they hungry? I mean, you can think of those kinds of things. Is there stress at home? All those things will undermine your efforts to teach them. And I realize now that I skipped, I didn't give you a chance to give me examples of constructivism. I'm sorry. But let's do this one and we'll go back and pick up those examples. So when we talk about Maslow's needs hierarchy, what we're doing is we're trying to get people to be true to themselves. In humanism, there's a sense that everyone is competent, everyone can accomplish their goals. We just have to set up an environment that supports them to do that. And so if you use this approach in your teaching, what you're trying to do is have the student have confidence in their own abilities. Now we have Maslow's needs hierarchy. We have Rogers' sense of a person's self-worth, and a person could be congruent or incongruent. If you deal with students who present to you a picture of themselves that's their ideal self and their real self is just hiding behind it, and you have to deal with this self that they're giving you. You know, they're telling you, well, this work is really hard and I can't seem to get this information, or I don't understand how these pieces go together. That kind of work, that may be the case, but what another student might be doing is really hiding behind the fact that they're just not doing the work. So they say, oh, this is really difficult. So you're not dealing with what's real, you're dealing with what they put out in front of you. Encourage your students to be real with you, to be honest, to be transparent. You be transparent with them also. That helps that process. It's important for students to see the person they are, their self-worth, their self-image, and their ideal self is coming together and not as separate things. They have to believe that what they are is good enough to be a competent student, to be a competent learner in your situation. So when you think about the kinds of things that are taking place in your classrooms, have you ever found yourself dealing with a student who's kind of creating this pretend person that you need to deal with, so you can't really reach them and help them grow? If you can get them to be honest with themselves, they're in a position, Carl Rogers tells us, they're in a position then to actually learn. If you're dealing with this unreal self, they're really not spending the time or the effort to learn, and it's not real. It's not going to mean anything to them. It's just like, good, I got through this. I was able to play this game with you and I won. And that's what we want to get away from. Have you ever dealt with game playing? I have a million examples of game playing. Actually, one semester I asked a student, how many grandmothers do you have? They were always going to grandmother's funeral. So what things do you think about with that? Have you had students that you have to deal with unreal situations, or they're afraid to tell you their real situation?
And I think just for me, just kind of resonates that, you know, like in clinical context, in a professional environment, like I find those situations really challenging, and I don't think I have a good strategy, because, you know, it's quite a balance between what you believe and what the learner's reality is. And, you know, potentially, you know, perception is different. So how do you bridge it without kind of overstepping the mark of what's professionally appropriate and saying like, mate, that's not on. Whereas what's happening for them might be real. So I mean, I can't think of any particular examples, but I would love to get your take of what are some of the strategies of how to get that balance right.
I can give you one strategy that I found effective, and hopefully this will help you, Daniel. My strategy is to say, I understand that because I want to accept where they're at, what they say to me. So I say, I understand what you're saying, and I understand that you feel that and believe that. The issue I have is that it's important for me that you achieve what you need to achieve, because I'm responsible for you. And if you make it past me and I don't make sure that you do that, then I am letting my profession down. How can we work together to address your needs and also to do this? Do you see what I'm trying to do here?
That's great. That's a great
Does that
one.
help?
Thank you. Yeah, that's great. Thank you.
Okay.
Tony.
You have to step back. You have to step back because, I want to take their necks and wring them sometimes. But you got to step back and say, okay, how do I actually navigate this in a way that I don't make them be defensive? Because being defensive puts that ideal self in front, and all their energy goes to protecting themselves instead of processing, how can I change and how can I learn? And that's what we want to do. Raj?
Yeah, hi. It's you find it sort of often when you're actually going and instructing on courses, for example, where you have a range of a spectrum of sort of seniority or hierarchy, like from PGY 1 to a consultant in the group, say, for example, ACLS group and all. Mm-hmm. And there you have that kind of gaming pattern and all. And you have to make it clear, you have to lay the ground rules, I guess, from the beginning. This is what we are teaching. This is what the expectation is. So that, and then from time to time in workshops and all, you also have to sort of, because it kind of happens in between, there's that interference or overbearing sometimes, or even not interested kind of situation kind of.
Absolutely. Yeah, you got that. You got that absolutely right. You just have to kind of work with the situation as clear as you can be and transparent in the beginning of your expectations. That helps. And then remind them of those expectations. And then if you get to a situation like Daniel and I just talked about, then you really you become almost like a counselor trying to unpack them a little bit so that they can see, look, I'm not trying to embarrass you, punish you. I just want you to get on the right track. And I think when they realize that you're trying to help them, I find those defenses come down, and hopefully that will help you. Okay. Great ideas, great questions. I would like to go back and say, do you have any examples from constructivism that you'd like to share? Anyone have an example?
Yeah, we, myself and Daniel, another Daniel on the course today, do a thing of procedural accreditation for some of the really dangerous invasive procedures. And we start by getting some online material that's been put together. And then we do some face-to-face learning. And then that's where we get to gauge where people are at. And then we try and reinforce it on the same day with some workshops. And then they go out and practice it on the floor and have formative assessments where they actually do the procedure with supervision, and then they've got to do a few of those, and then they actually have sort of maintenance of practice, and it's this sort of ongoing thing as we're trying to reinforce that they're dangerous, you're continually learning and you're trying to minimize risk, and it's just perpetually going round and round like that.
That's a great example of scaffolding, Alex, where you're trying to get the student closer and closer to the reality of doing it, and at the same time protecting the patient as you're moving in that direction. So what you're doing is, and I always love the idea of just have them tell you what to do as you're doing the procedure, because you can see if their reasoning is straight. And then when they do it, as you're saying, monitor them as they're going through this process. Thank you for sharing that. Appreciate that. Okay, the last classical theory I want to talk about is social learning theory. And I think this is really kind of interesting because if you've studied, again, Psych 101, Bandura had his bozo doll, and when somebody beat the bozo doll and another child observed beating the bozo doll, they would beat the bozo doll too. So this idea of learning vicariously by watching someone else is really a great deal of what takes place when we're talking about learning in medical education. As we're adults, 75% of our learning is actually our experience. We learn it through our experience. And so this is really critical. And the thing that's really important is grab attention. And you have to have something that's going to capture their attention so that they're focused on the activity. Then they need to rehearse it cognitively in their mind. They need to think about it. They need to talk about it. They need to understand what it's all about. And this kind of is even following what Alex was just saying. They're thinking about what they do and how they do it. And then what they need to do is they need to physically practice so that they get their body involved in the process of what they're learning. And last, they need to feel some kind of reward. And the reward doesn't have to come to them exactly, but it can be a vicarious reward by seeing someone else rewarded for doing that behavior. And much of what you learn in surgery follows this kind of a path. Much of what we learn in a lot of different areas in our professional careers follows social learning theory. It's kind of a combination of behaviorism and constructivism together. And I think it's kind of cool. You can give me an example and I'll share an example with you in this little cartoon. Can you read it? Okay, I'm wise. I see you, med student. Am I the see one, do one, or teach one case? Okay. and that's really, that very practical way of learning in medicine, see one, do one, teach one, is very much part of social learning theory. You have any examples you want to share?
I'm just wondering, we might have a different slide in another 20 years, probably with a different theory now, because that theory is actually kind of...
Yep, I know that one's hopefully fast disappearing, but still prevalent, Raj. Okay, let's talk a little bit about adult learning theories. Now, in the mid-20th century, there was kind of a beginning recognition that, most of the classical theories came about as we studied children. And then about mid-century, we realized that, adults are a little bit different than children. And you might have heard of Malcolm Knowles, and you might have heard of pedagogy and andragogy. And there's lots of debate about, is that real, that there is really that separation? And I don't know if it's real or not. But what I do know is that when you teach adults have a lot of experience from which to draw when they're learning. And adults also need to know, they almost need just-in-time learning. What they want to know what they need to function in their jobs, in their work, in their world, in their personal lives now. And so children tend to be driven by those two things. So that's what I see as different. So if you're a fan of andragogy and pedagogy, that's what I see as the break of it. And if you don't think there's any difference, that's okay too, because it is a great debate that learning is learning. But Malcolm Knowles gave us 6 assumptions for adult learners. First, adults need to know why they're learning it. Secondly, they move from being dependent learners to being self-directed learners. They want to be in charge of their learning. They have a reservoir of experiences that become an increasing resource for learning. So you need to bring in their experience when you're teaching. Their readiness to learn becomes oriented to social and professional roles. So they want to learn something that they can apply in their life and in their work. Their learning shifts from subject-oriented learning to problem-based learning. And so the idea is they're not just trying to learn a subject to learn a subject, but they're trying to learn how to address issues, problems, concerns that they have to deal with every day. And their learning shifts from being extrinsically motivated to intrinsically motivated. They focus more on process than specific content because they want to solve issues, problems. Examples of these are things like case studies, problem-based learning, real life learning experiences where they're being guided through a process of training. In these roles, the instructor serves more as a facilitator than a purveyor of knowledge. The instructor helps, guides, supports, finds resources. You have examples for this to share?
I think like a good example of this is sort of in simulation. So in simulation medicine, when you have medical students in there, it's often very much facilitator led. You have to really go in and get the conversations going, discuss the points. But when you come in and you've got a group of experienced practitioners, you can really just go in and let them discuss it. And they just discuss the points that they want to have. They just discuss what happened in the scenario. And really as a sort of simulation facilitator, your role is really just to help navigate the conversation as opposed to be a facilitator, just join it.
That's an excellent example, Chris. And showing the medical student against a much more advanced professional, the medical student is almost like in transition, that they can do some of this, but not all of this. In some cases, they're very dependent, thinking you're going to tell them the answer, and they're not really thinking about how do we do this better. They're just trying to master where they're at. So yeah, that's a very good contrast. Thanks for sharing that. Another example, anyone? Oh, go ahead.
Yeah, I just from teaching on courses. So, in addition, so it's normally, for learning about pediatric life support is a course I was taught on, and the people who are there are motivated because they want to progress in their training or they want to acquire a skill that makes them feel more confident at work. And normally, it is very much more motivated. And so they're coming there as, sort of self-selecting out as a particular learner who wants to progress or enhance their skill set, and find that probably more inherently rewarding than just handing over knowledge with people who want to, you to provide knowledge to them. It's, as you said, it's problem-centered or relevant to their work practice.
Awesome. Thanks for sharing that one, Alex. That's great. I want to talk about did somebody else want to talk? Leah Hong, do you want to say something?
Yeah, I
We can't hear you.
Oh, I just wanted to share that I was part of the first graduate medical course.
Could you get closer to your mic? I'm sorry.
Oh, can you hear me now?
Yes.
Okay. I just wanted to share that I was part of the first graduate medical course in Australia. And we were people with certainly lifetime experience, but we had to battle against the traditional medical course people because we had 3 years of that still kind of lagging behind. So it was very interesting to see what the lecturers thought of us and their lack of confidence in the fact that we didn't have much basic knowledge. But we then, I guess, time has shown that we were a lot more self-directed problem solvers, and we're all specialists now. And when we started, I think they were just...
You're actually illustrating another one, and I'm just going to skip to it since you're talking about it. Paulo Freire, who is a Brazilian educator, and talked about critical pedagogy. And when he talks about, this is the later into the 20th century, and this is where we're really talking about the need to understand that people come from very different backgrounds, and that the people who are giving information, they're not banks who deposit information in people's heads, but he called that the banking concept of education. And he's saying instead what we need to do is make sure that our learners are taught to be critical thinkers, that they examine everything that's being shared with us, that they question what we're doing, and that we as teachers need to be open to the fact that they bring experiences that are rich and ought to be part of what the learning is all about. So you just illustrated that one, so thank you. I'm going to go back now. I want to talk about Schoen's model for the reflective practitioner. And this is really important to keep in mind for yourself and for your students, particularly those that are moving towards being self-directed and taking care of their own learning as they're more advanced in their work. When we talk about the reflective practitioner, what we're talking about is we sit in a zone of mastery of where we're at. This is our knowing in action. And then we're surprised because something didn't work right. Something didn't work the way we expected. And so we have to think about it. So we reflect in the action. And then we come up with an idea of what we want to try. We experiment with it. And then when we put that into place, we reflect on what we did and what the outcome was. And if it now gives us kind of a sense of mastery, we go back to the zone of mastery. But if it doesn't, we keep in this circle where there's a surprise again, and we keep working on it. So we're constantly reflecting and changing what we're doing, and then seeing, does that make a difference? And that's Schoen's process of reflective practice. And the thing that's important about it is if we can teach our learners to be reflective practitioners, what they do is they are really taking all the experiences they have and trying to integrate them and evaluate them and analyze them so that they can take those things to help them move effectively forward, and so that they can question what is and plan for what could be. So that's what we're trying to do. Do any of you work with people who are in the state where you're just trying to get them to see this kind of a flow of constantly making things better?
I mean, I feel like any procedural skill that gets taught in medicine falls within this realm of, the first time you do something, the first time you cannulate someone, you have no idea about the tactile feedback and what you're meant to know. But after a couple months or a couple years of cannulating, you recognize what it feels like to get inside a vein. It's the same for any procedure within medicine, which I think is why we try to use simulations and cadaver courses and things like that to sort of instill that mechanical knowledge so that there's less surprise, I suppose.
Absolutely. Well, yes. But, the surprise is really, it's not like, what is that? But, just something's a little different and you need to adjust. You need to change in some way. And learning is change. So if you think of that helps you understand that. It's what needs to be changed here. I want to share Kolb's experiential learning and learning style because he also takes the same concept. He builds it out a little bit more because he talks about you have a concrete experience, you go into a reflection, observing it, then you develop this abstract concept of it and you actively experiment on it. And he sees this reflected in 4 different learning styles. You're either diverging, where you tend to feel and watch, you're assimilating, where you think and watch, you're converging, you think and do, and you're accommodating, you feel and do. And these learning style is like out of favor right now. It comes in and out of favor every so often. But the thing I think is good about it is to think that your learners are learning differently. They don't learn the way you do. They have values and beliefs and experiences that are driving how they're learning. And so they may be the same or they may be different than yours. But think about what are the different ways in which your learners are learning and how do you adjust your lessons to be able to handle those learners? An example where you had to adjust a learning or a situation because you realized your students were experiencing it different or processing it differently. And you might hear this sometimes as people say, I'm an auditory learner, I'm a visual learner, I'm a kinesthetic learner. So you hear this in different ways.
I see this most in the new intake of interns each year. There's a spread of interns that come in each term, and basically there's a spectrum that like to watch and think about stuff, and they're clearly heading towards physicians training. There's a whole bunch that like to just get on and do it, and they're heading more towards the surgical end of the spectrum. And there's the few that we pick in the middle that are able to move around between all these different points, and they're the ones that we want in emergency medicine training. So we look out for them.
Awesome, Mon. Thanks for sharing that. Okay. Now we talked about some of these. I know we went through these quickly, and I'm sorry we have to go through them quickly, but I think that gives you a sense of different ways of looking at teaching, and you can explore them more as you go forward in your training. But what challenges do you face in your teaching that we might be able to talk about here? Or what would you want to accomplish more in your teaching that we can talk about where learning theories will help us? Either of those questions. Any thoughts?
Honestly, the biggest challenge that I face with teaching at work is time. I feel like there's this expectation of teaching on the run, and I have the best of intentions, but as soon as things get a little bit busy, I have a really hard time juggling teaching with getting on with the job.
Absolutely. That is always something we're struggling with, Victoria. And I think the thing to think about is the more you practice just trying to think about what can you teach in a situation, and you begin to notice what we call teachable moments. When you see something occur and you can, just throw out a little pearl of wisdom or a technique or a strategy for a student to gather. But you may also want to keep some little a note card in your pocket or you say it on your phone, something that, I got to tell them about this when we have time to talk about it. So just having some strategies like that. I've worked with physicians at Hopkins in the preceptor for clinics, and I've worked with them, shadowing them when they've been following ER on Friday night at Hopkins in the middle of a inner city. So it's been interesting to watch people in those circumstances. And there's times when you can teach and there's times when you can't teach, but you can take note of what do you need to work on with them, and just try to get that mindset. It takes it takes a little bit of practice, Victoria, and you're always working on it. You know, we're never perfect. We're always working on it. But if you can do a strategy like that where you can capture it. Another issue that you run into is when something goes really wrong and you're really upset, it's not the time to teach. You know, it's time to say, let's plan to meet at this time and we'll talk through this. So you have to think about those kinds of things because the situation that you're in may be such that it's not appropriate. You're not in the mindset. They're going to be so upset that they're not going to hear what you're saying anyway. So you have to think of that. I heard somebody say something.
No, Tony, I was just going to highlight, I agree with Victoria. Time is always an issue with emergency physicians, but also it depends on situation, like protected time versus non-protected. And teaching on the run also is very different. Are you actually sitting with a trainee and actually observing them for a certain task, like we do workplace-based assessments, or often like in the morning rounds, I would go around, for example, and sort of check on certain things, like as you said, some things which are teachable, and it catches you when you actually, because with experience you, okay, well, this is something which they should know about. So I've just sort of the challenge for me in that one is sometimes I would start asking rather than telling them, and I've now sort of kind of refined myself, especially during the morning round. I think, okay, it's no point really posing questions rather than delivering, okay, well, this is what you should know, this is what I've just come up, but this is very striking. So I'm using that more now rather than pausing for a couple of seconds, asking, and then the night guys, I can't expect the night guys to tell me, and the morning guys are already like still getting attuned. So it's like, yeah.
Yeah, that makes perfect sense. And I know I've taught groups of residents that were half asleep in the room while I was trying to teach because they were so dead from working. So, you know, I appreciate what you're saying. What you're talking about gives me some things to share with you. One thing that I want you to be aware of, I don't know if this is an issue in Australia, it is in the US, and that's pimping. And when you're pimping, you're putting students on the spot, you're embarrassing them, you're scaring them, and it's a great way to classically condition them to be terrified of you. So, you know, if you can think of ways to ask questions or to get information from them without pimping, you'll find that it'll be a much more productive situation. They won't be trying to hide or drop a pencil so they don't look you in the eye. You know, they won't do those kinds of behaviors. That's basic behaviorism, but I wanted to share that with you. The other thing is building on what Raj said about, you know, when you have students that are really tired, or maybe they're just not sure of an answer, just say, what might be some of the things that we would consider in this situation? So you kind of open it up and say, yeah, let's look, and you can just say, if you can share an idea, and then let's look at it and see if that's a good one for us to use, or maybe we need to modify it a bit. And what you're doing is you're shaping the conversation. It's not just that you're right or you're wrong. You're really just shaping and working with the conversation. And also reading the students. As Raj says, he knows that the residents are half dead. He's not going to ask them questions because they're not going to process it. You need to ask them questions when you know you have them. But something to also think about, you know, we say we don't have enough time in teaching. I've taught people how to teach actually while they're in the clinics and while they're doing rounds and things like that. And the one thing that I had was them telling me, they have so much to learn. I got to get all this information in. And so we took a class, and we took half the time of the class, and the person taught the way they were teaching. And the other half of the class, I told them, we took all the information he was trying to teach, and we made it into just a couple of questions. The first half of the class, they were exhausted, so they were just falling asleep, laying on the table, half paying attention. Then we got to the second half. They took a break and came back, and he said, what do you think about this? What about? And they were engaged, and they were sharing. And he walked out and he said, okay, you convinced me. So sometimes we're trying to teach too much, but if you think of what are the main concepts I've got to get across, and what are the references I can let them know about so that they can build on this. Again, they're scaffolding their learning. They're one time through you. They're not going to learn everything. They're going to learn some, and then they're going to circle back and do some more, and then they're going to circle back and do some more. That's your constructivism working, circling back, constantly spiraling in your education. Be confident that that will work. We're coming to the end of our time. And so I want to thank you for everything that you've done. I just want to say, think about what 3 things did you learn? What 2 things will you remember? And what 1 thing will you do? And notice This is my assessment. This is your assessment for this thing. The final thing I want to share with you is I'm with Johns Hopkins Master of Education in Health Professions, and on here is an address if you're interested in it. We're interprofessional, 5 schools: medicine, nursing, public health, business, and education. Established the program. Teachers come from all those schools, and teams of them from 2 different schools teach in each of the courses, so you get an interprofessional perspective. We use an interprofessional literature and even add dentistry, pharmacy, and allied health to that. We're concerned about what you learn and apply it immediately. We're built on classical learning and adult learning theory because we want you to be strong. And finally, we're a community of educators focused on the health professions. We're a global community of almost 500 strong now, supporting each other while people are in the program and after they graduate to be medical educators who transform health professions education globally. I want to thank you for this, and I hope you have a great rest of your conference.
Thanks, Tony.
Thank you.
Thank you.
Thanks.
Thank you.
Thanks, Tony. Yeah, that was great. That's exactly what I was hoping for the first session. And obviously I can speak from experience that the MEHP program has been certainly transformative for me. So I'd highly recommend it to everyone who might be interested. So huge thank you to Prof. Angareddy for leading us through the first session. If you do want kind of further information about the MEHP, then you're welcome to have a chat to me as well, and I can put you in touch with Tony.